Okay, I think as everyone's getting situated after a delicious lunch, I just want to, again, welcome everybody here, and good afternoon. I'm Sarah Nouri. I'm a physician researcher in our Division of Palliative Medicine, and I'm also honored to serve as our inaugural Associate Chief for Diversity, Equity, and Inclusion. Thank you. Thank you. And I just wanted to share a little bit, while this leadership position in our division is new as of this year, it really stems from years of increasing understanding and really work that the core principles of diversity, equity, inclusion, belonging, and justice are deeply intertwined with our work in palliative care. And a recognition that these principles must be put into practice in our work with each other, with our patients, and with our larger community. And my vision for the DPM is for the DPM to be a leader in anti-oppressive palliative care by creating really an equitable, inclusive, and accessible climate for all of us who are part of the DPM, for all of our patients, their families, their loved ones, and our community at large. So that we can all thrive. And I think this is a particularly important time for that, both locally, as we heard this morning about really thinking about how do we increase access to palliative care for people who need it, as we think about kind of broader issues across the University of California now and our work climate. And I think it's also really important worldwide and everything in between. I think from Dr. Higginson's talk, learning about getting that perspective of how is palliative care situated in the world and where are there particular disparities or needs, thinking about how palliative care relates to broader justice-related issues like climate, like war, displacement, all of which are increasing, at least displacement is something that's certainly increasing. And so thinking about how do we really provide the best palliative care for people in kind of our most vulnerable communities. And so our priorities, just broadly speaking in DEI this year in our division, are really to improve inclusivity and belonging across our division and across disciplines, to center DEI in our curricula for fellows and other learners, and also in our skills as educators, and to grow and diversify our tremendously important Patient and Family Advisory Council, and lastly, to expand our community partnerships. And so in this next hour, I'm thrilled that we get our community partners and several members of across our different disciplines in the DPM will have a chance to share more about these two key priority areas. And that brings me to our first session today, which is about community and health system partnership. And again, as you heard a lot about before lunch today, our division is really leading and engaging in pioneering research and clinical innovation. And a big piece of what I think is important is to make sure that this innovation can reach beyond our immediate health system and into our community. And so I think really to address the inequities that people are experiencing in access to palliative care and quality of palliative care, it's essential that we partner with our community. So it's my absolute privilege to introduce Kelly Dearman and Anni Chung, who are co-chairs of the San Francisco Palliative Care Work Group. Kelly is a lawyer by training. She's had a varied career, initially starting off as a lawyer with expertise in elder care and probate law. She has over 15 years of experience in developing programs and services for older adults in San Francisco. And she is currently the executive director of the San Francisco Department of Disability and Aging Services. And prior to this position, she was the executive director of the San Francisco In-Home Support Services, the IHSS public authority. I could go on, but I'll move on to Anni, who I could also go on for. But Anni Chung is a social worker by training, and she is the founder, president, CEO of Self-Help for the Elderly, which is a community-based organization that provides a variety of services to, I think, over 40,000 older adults now in the Bay Area, so tremendously huge impact. And Self-Help for the Elderly provides a comprehensive range of services, so around health, housing, education, other resources that folks need. And it's primarily focused on immigrant populations, people with low income, limited English proficiency, especially in the Chinese and AAPI community. And Annie has been also invited by Governor Newsom to serve on the California Commission on Aging. So again, I could go on and on about both of them. Incredible people in our community, incredible role models. And I'll just join them here and continue kind of our conversation. I'm wondering, Kelly, if as we're getting started, if you could tell us a bit about the palliative care work group and how it got started.
Sure. First, thank you so much, Sarah, for that. And I have to keep my glasses on because I can't see my notes, and then I can't really see you guys, so you're all blurry. And I just want to say yay to all of you and palliative care and awesomeness. Am I right? Right? So thank you. I just want to thank you all for what you do. It's super important. My mom, after having MS for almost 60 years, finally, another hospital, said, we think we should put her in palliative care. I'm like, you think? So it's been about 8 years, but it's been fantastic, right? It has really changed our whole life and how we navigate all of the systems. So I cannot thank you all enough for everything that you do, and encourage all your friends and family to join us. So the palliative care work group was formed about almost 10 years ago, and actually our 10-year anniversary will be May 29th. We had our very first meeting 10 years ago on May 29th, which took place at UCSF. And we were originally known as the San Francisco Palliative Care Task Force, and we were developed through a partnership with San Francisco's Department of Public Health and my office, DOS, that was before I got there. And with the whole goal of ensuring that all San Franciscans would have access to palliative care now and in the future. So we got together this whole group, different set of stakeholders. So we had health systems, medical groups, hospice agencies, skilled nursing facilities, IHSS, family caregiver organizations, senior centers, and health plans. And with the goal of let's all sit at the table and figure out how we can make palliative care accessible.
Thank you, Kelly. I wonder if you could talk more also to how UCSF has been involved in the work group over time.
Sure. So, well, we wouldn't be here without the partnership with UCSF. And UCSF was one of our initial founders. The original meeting, as I said, was hosted at UCSF Mission Bay. And Steve Pantalot, I saw you. Well, oh, you're right there. He delivered the opening remarks, and UCSF also played a really significant role in the early years through the leadership. Our co-chair back then was Christine Ritchie, and we also had other members such as Red Wing, B.J. Miller, and Kinderman, and Jeff Newman. And it's been pretty awesome how UCSF has stayed so engaged with us the whole time. And all the members who are still at UCSF remain active in our work group. And we've attracted new members like you. And we're super grateful to you because you're part of our steering committee and you lead the evaluation of all of our activities. Bridget Sumser, where are you? Right there. I can't see the glasses. She's another steering committee member, and she's been taking the lead in conducting community outreach activities and also educating community leaders like care navigators and social workers at senior living facilities. Reverend Natalia Johnson is one of our most popular community workshop leaders and has really worked with us to foster our relationships with organizations like Unlock, Bayview Senior Services, and Third Baptist Church. Donnie, I see you right there. You help us a lot. So thank you. So I just also want to mention that we use Prepare, which is the easy-to-use advanced directive, which was developed by Rebecca Sidori, who as part of our community outreach activities. So UCSF is very much involved in everything that we do.
Thank you, Callie.
You're welcome.
I know I'm also looking around the room and seeing how many people here really led to the formation of the group and are such active participants moving the work forward. A lot of folks here have heard about one of the recent initiatives of the Palliative Care Work Group, the Learning Journeys. And I was wondering if you could talk a little bit more about how, kind of what led to the idea behind the Learning Journeys and yeah. Thanks.
So it was really important to us to figure out what's going to make the most sense. What can we do that will have like a real impact on not just palliative care, but how we can reach out to our communities. So we got a grant from the Gordon and Betty Moore Foundation, and then we used some of that funding to hire Lauren, thank you, Lauren, from Transforming Care Partners to help us develop a strategy as to how we could have the most impact. And so after a lot of interviews, and surveys and analysis and all of those things, we decided to right, yes, a lot of spreadsheets. We decided to focus on building awareness and education about palliative care and advanced care planning in the Chinese, Latinx, and Black communities. And so what we realized was that we were aware of many of the barriers to community engagement in advanced care planning and palliative care, but we didn't know how to overcome those barriers. And so thanks to the support of the Stepsky Foundation, we launched the Learning Journeys, and which was really, which reminds us that it's important to engage with the community, have the community lead it, and we really learn from them. And I would say that we continue to learn from our communities and working with an academic institution who can help us do all that spreadsheet stuff and all the technical pieces. But we continue to have activities, and 2 weeks ago was National Healthcare Decisions Day. And so we had, once again, more engagement with the community. We had our press conference out at Bayview Senior Services. And then we had a series of 14 events over the course of the week. And again, we know that partnering with community is what makes those events work. And so I went to an event with Anni at St. that was hosted by Donnie. At St. Francis. And so I don't speak Chinese, but I was there, and the doctor who spoke, I know her name, hold on. Anita Ho. Yeah. Anita Ho, who was fantastic. So she spoke in Chinese to the group about, it wasn't translated, you guys. This is just me picking it up from watching. About advanced care planning and what role it played in her life. But just sitting there and watching these seniors hear that and feel that was so inspiring to me. So I am reminded that nothing works if we don't engage our community and work with our community and have them lead it for us. Okay, I'm done.
Thank you, Kelly. I really appreciate that anecdote, especially about just being able to pick up on the feelings in the room and how Dr. Ho's personal experience and her work as a bioethicist, et cetera, was landing on people. And I think really highlights the key, piece of having that community and health system partnership that can help all of us. I want to turn it over, Anni, to you for this last bit, just to hear. So Anni actually chaired the Chinese Community Committee for Learning Journeys, and I mentioned earlier her own work in leading self-help for the elderly, and she has since been spearheading a number of initiatives on increasing engagement in advanced care planning, especially in the Chinese community, developing really new models of palliative care delivery. And so I'm hoping, Anni, if you could speak to some of these initiatives that you've taken on recently.
Thank you, Sarah, and hi, everyone. So my palliative care and advanced care work, I thought started about 6-7 years ago. But lately, Lauren showed me the minutes of the 10 years ago when we met at the Mission Bay, and I couldn't deny it because my name was there. So now I have to say I've been introduced to advanced care planning. Not so much palliative care then, because even advanced care planning for the Chinese monolingual, particularly aging, our elderly community, is such a taboo and is such a topic that no one would talk about. Not even us as the trusted social workers of our seniors. If you mention, oh, by the way, can we talk to you about planning, in the future? And they would turn away and just leave the conversation. So for a while, self-help really couldn't do much about it. But then I think about 7 years ago, Rachel sent me, to Rebecca's workshop on Prepared, as well as the Heart to Heart Cafe from Sandy's group. So I sent over 25 of my social workers there and our social services staff to learn about advanced care planning, because I felt that we couldn't really convince our elderly to do this if we are not convinced. So after that year of training, and then I think Lauren got me onto the Chinese learning journey, and I think that Kelly asked me to, co-chair the work group, and I felt that it's time to really roll up our sleeves. We did the learning, now we have to actually get our seniors to start the conversation and then complete the directive. So we went through 2 years of the Chinese learning journey to learn from my staff and Carrie, who's our ambassador staff hired, about what's the barrier to the monolingual community that make this topic such a difficult topic to talk about. So then we learn how to give the right messages under what setting, and really what do you need in the community as resources in order to bridge all of this barriers, I would call. So that's how we go down little bit, and then I think I asked Yu Ling, who head up this initiative at Self-Help, my director of the social service department. So for the past 2 years alone, when after the Chinese Journey committee did all the research and the looking, at the issues and the barriers and what are the right messages that Sarah put together in reports for us, we had a grant from Stupsky to do a re-granting in the Chinese community as to what projects will make advanced care planning and palliative care more acceptable. And so I did that. I oversaw the committee, and we did about 6 projects, which I probably later could elaborate a little bit. And they all kind of work with each other to engage the community, the elderly, the family, in order to advance really this whole palliative care and advanced care planning work. So that's how Self-Help for the Elderly got into this space.
Thank you, Annie. I wonder if you could talk a little bit about the projects from the community grant-making projects, just because they were so, fascinating and so interesting and different.
We have 7 committee members that were committing to about 2 years of work with the community, and we felt that it's very little time, 2 years, but we have advanced kind of work done, all right, or the education piece, the PowerPoint piece, they were all there, right? So I pulled this committee to do a first brainstorm as to what other projects will help each other to really make this work even take it further. So one of the committee members, Linda Wang, who's my former board member and worked in the mental health field for a long, long time. So she said, if we are to go down this journey, make sure that the projects that we are funding are all kind of connected with each other, so that it's not like one project here, one project there, and one project there. So with that as our goal, we started off with the ethnic and social media outreach, because we want to kind of like cast the net to as wide, a a population as we can reach. And after the ethnic media and the social media reaching literally, really, I think so far we have reached about 35,000 people who have not heard about advanced care planning before through a lot of these contacts. And then after that, we have a training of bilingual interpreters who will work, trained to do intensive interpretation. And then we ask the graduates to come back to the community setting when we need them and when we do these ACP workshops to interpret for us. And the third project we did was a deaf over dim sum, which is the facilitator is a deaf doula, Elizabeth Wang, and she was trained by the end-of-life movement, the Reimagine, as a deaf doula, and she did 3 workshops for us to try to reach the second generation, the children, who find it very difficult to open up and ask their aging parents what do they want, you know, what are their values, and if they are faced with serious illness, what kind of really, what kind of planning do they want? And what do they want from the children? So all these conversations almost seem never happen. But through Elizabeth's work, we're now beginning to see first generation, second generation kind of sitting down and talking about it. And then the last project that we did, which I think had a lot of high impact, was to create a ACP and peer ambassadors program. So we train 5 or 6 seniors who are already attending a lot of our senior centers to do the work of the ACP. And in these settings that Kelly attended, this big workshop that Donnie did at St. Francis, over 105 seniors came, and in their tables, our ambassadors would sit with them, go over the forms with them, tell them their own experience. And then on that day, Kelly didn't mention that our success was 10 seniors right there signed up and finished up fulfilling that plan, the one that Rebecca did. So it was wonderful to see such a kind of spontaneous response to a workshop like that. And I think that the ethnic media articles that we sent out to the Chinese press, TV, and radio really helped to get the message out. And then the one-on-one workshops that our staff team and our ambassadors now are doing with the seniors when they come back, whole family meetings. Sometimes it takes like 6 to 8 meetings in order for them to feel comfortable. So those are 5 initiatives, you know. And then Carrie did 10 other focus groups to find out that if we are to take the ACP education workshops to the senior building, senior housing, and where seniors meet, what are the most important elements of these focus groups? How much gift card or as an incentive are the best? We found out that money really isn't the incentive, but it's the elderly's readiness to talk about it and to actually talk to their family about it. So I think that we're wrapping up our project in June. And I think so far, what did my staff say? 35,000 people reached, over 100 ACP workshops have been done, and then 300 forms have actually come back, signed with the health agent pig now in our database. So that's to show you that if you put your mind together, I think we could really make it not just put a dent, but now I feel that the St. Francis experience make me feel that the seniors are starting to be much more receptive to talk about ACP. Yeah.
Annie, I think it's safe to say you've made way more than just a dent in this work, especially in reaching so many people in our community. And I think your these examples and your teamwork with many different community partners is just, again, a testament to how critical it is and how innovative the work is that comes out of the community addressing these ideas. I think we're probably over our time a little bit, so I want to wrap up by just announcing something that the three of us are very excited to announce in partnership with Lauren, our executive director for the work group. UCSF, our Division of Palliative Medicine, is officially partnering with the Palliative Care Work Group starting now this spring, and we are launching this summer, hopefully, our first cohort of UCSF ambassadors. So folks from the Division of Palliative Medicine will essentially partner with a community-based organization for at least a year, and it'll provide a great opportunity for kind of bi-directional learning, growth, and hopefully lead to a lot more community events and a better understanding on our side, on the health system side, of how we can support folks. So we're very excited to start that program.